Good afternoon, everybody. Dr. Michael Jacobs here with our Monday afternoon Instagram live chat. Welcome, and it's good to have who is ever with us here today. And today's topic is IVF. How many eggs should I expect at egg retrieval? And this is always a question that comes up many times during an IVF cycle. And I think managing expectations is probably one of the single most important things while we're treating patients with IVF. And a lot of times your visits are by nurses and doctors or a combination thereof, and people want to know that they're doing good or not good and what kind of things to expect. So how do we know about how many eggs we can expect, and at what point can we be more specific about it? And remember, with the IVF, the beginning of the process is having you on fertility drugs. During that time period of 9 to 12 days, we do 4 or 5 ultrasounds, one every couple of days, and blood tests to monitor how you respond. So the first indication of what we might expect actually occurs before we even start an IVF cycle. We do some ovarian reserve testing. We check biologic markers, in addition to asking you how old you are. The older you are, in general, the more resistant the ovary, the less eggs we would expect. The younger you are, the more eggs we would expect. People with polycystic ovaries tend to produce a lot of eggs rather than fewer eggs. And then we use the biological markers of AMH, which is anti-Müllerian hormone, FSH and estradiol, follicle-stimulating hormone, and estrogen. And lastly, what's called an antral follicle count. We can actually measure the little black lakes in the ovary on day 3 of a cycle. And although there may be some variation from one cycle to the next, there's a general trend that exists, with 5 to 10 antral follicles per ovary being normal. So with that information, we can figure out what the best stimulation protocol is and what medications to use. And the expectation is that if there's more resistance, we expect less of a response. We tend to try and compensate for that by increasing the amount of drug that we give you. So now you start this medication and you start coming in for these visits, and we start to see the follicles develop. And a follicle is just a small cystic structures in the ovary where the eggs live. And if that particular small little follicles containing an egg, during the process of being stimulated with these gonadotropins, the fertility drugs, there'll be secretions within that little lake of fluid, so the lake will start to grow. You can't see the eggs themselves, but you can see the fluid that surrounds the egg. And by looking at how many of them are developing and the sizes of these little black lakes, we can get an idea of how many follicles are developing. Now, from the decision-making standpoint, we like to get you to the point where the leading follicles are in this 17 to 21 millimeter range, basically, and the secondary follicles, the ones that aren't quite as big, are in the 15 to 17 millimeter range. So in general, you like the leading follicles to hopefully be 18 to 20, and the secondary follicles to be 15 to 18, and smaller ones under 15. You occasionally will get good eggs from, but a lot higher percentage of them, particularly from the smaller follicles, will be immature the smaller the follicle is. So it's important to understand the differentiation between eggs and follicles. Follicles are just what we're looking at on ultrasound. Eggs come from those follicles, but the eggs that we're able to utilize to fertilize with IVF have to be mature eggs, and they come out of the follicles that are 15 to 20 millimeters on average. Now, you're not going to see follicles that size on the very early days of stimulation. So when you come in and start fertility drugs, the first day of the fertility drugs is arbitrarily called stimulation day 1 or cycle day 3. And then we bring you back usually 4 days later, and then 2 days later, and then 1 or 2 days, depending on how you're responding. And so usually up until the middle of the stimulation, roughly day 10 of the cycle, we don't really have a good idea as to what's going to grow and what's not going to grow. So up until then, we just know there's a group of eggs, or there's a very limited number of eggs, and then a follicle is better at that point. And then as we get closer to the time, as these follicles grow, and when we're basically on day 10 to 13 of the cycle, we have a much better idea of what we might expect. And particularly, around the day before or the day of the trigger of the release of the eggs with either HCG or Lupron to get the eggs to ovulate, at that decision-making point will usually be the point that we feel we're going to get the best batch of eggs from your ovary. And that will vary depending on how many there are, whether it's beneficial to go another day of medication, and sometimes we may sacrifice a big follicle to get 5 medium ones that are going to be better tomorrow. But in general, we try and go with the leading batch of follicles as usually the best approach. So the simple answer to the question is, one, remember that number of follicles and number of eggs don't always correlate with each other. So the number of follicles that have at least an average diameter of 15 millimeters to 20 millimeters, those follicles at the time of HCG, the day of trigger, usually will contain a good quality egg. And the hormone levels, the estrogen levels that we get, are taken into account relative to the response. And because the hormone level is it's a sigma, it's a sum of all the little amounts of estrogen that are made by 5 eggs or 12 eggs or 18 eggs, however many you're making. We don't know how much estrogen came from each follicle, but in general, we can gauge the relationship with the number of eggs, the size of the response, and how your estrogen has developed over the past few days to give us an idea of what to expect. When we go to retrieve eggs, we try and get eggs out of follicles no matter how big they are. If they're small ones, medium, large ones, we try and get eggs out of everything. But a lot of times, even though we're really good at getting eggs out of follicles, if they weren't good eggs to start with, they're not going to be good eggs. So sometimes we'll be surprised and we'll get a nice mature egg out of a 13 millimeter follicle. We try and aspirate anything over 10 millimeters in general. But in reality, most good eggs come from follicles that are 15 to 20 millimeters in size, and between 13 and 15. We may get some, particularly because even after the HCG is given, these follicles will grow over the next 36 hours, so that by the time we get to the eggs, they're there. So the answer to the question of how many eggs should I expect at retrieval, the very beginning answer to that is, before we even get started, we can put it into a bucket basically and say we're going to get not that many. We would expect to get an average amount for somebody of a given age, or we would expect to get an over response of it. We'll adjust the medication doses to try and maximize your response to get the best number of eggs. While in the cycle of treatment, we can begin to see how many are beginning to develop, usually after 5 or 6 days of medication, but it's usually not until 8 or 9 days after you start the fertility drugs, between the 11th and the 13th day, that we really have a good idea as to what we're going to expect to get at egg retrieval. So you can always ask your doctor or nurse, and if a nurse is scanning you, and you want to talk to the doctor, just let us know. One of us will stick our head in and answer your question. But in general, the day of the HCG, follicles that are 15 to 20 millimeters in average diameter are in the sweet spot. Those that are 13 to 15 may have mature eggs. And then, of course, the answer is, what do we get at the end of the day? These eggs going to come out? Eggs that don't release properly from the ovary are usually poor quality eggs, immature eggs. Occasionally you might get a follicle that's really a cyst and there's nothing in it. So how come I didn't get something out of the biggest one? Sometimes it's because it wasn't a good follicle developing. It was just a simple cyst of the ovary. So that's a simple way of looking at it. I think it's the easiest way to looking at it and understanding it. Just one, the differences between number of follicles and number of eggs, and two, once you get the eggs, how many are mature and how many are immature, and then the mature eggs are the ones that we have to work with to either cryopreserve for future use or to fertilize for IVF. So I hope that brief introduction to how our brain works and how we think about things has been helpful to you people. And we wish you well on your treatment of fertility and success sooner rather than later. So have a good afternoon. Take care.